Hello, everyone. Welcome to Drug Safety Webinar 2.0. My name is Pharmacist Adebi Omomi Beatrice, and I'll be moderating tonight's section. Um, the webinar is going to take 3 days, and we're going to have our amazing speakers by the names Pharmacist Penny Kwebari, Pharmacist Chidebere Okeke, and Pharmacist Ogunsesi, who collectively will be talking about the safe and effective use of contraceptives. But tonight we're going to have our first speaker by the name Pharmacist Penny Kwebari talking about the principles of contraception and types of contraceptives. Pharmacist Penny Kwebari, the floor is yours. Welcome, sir.
Okay.
Hello, Pharmacist Penny, are you there?
Yeah, I'm here.
All right, welcome, sir. The floor is yours.
All right. Thank you very much from Beatrice Omowumi. Good day, good evening, good afternoon, everyone present, and those that are to join us from all parts of the world. So we are here once again for Drug Safety Webinar 2.0, as the moderator like they have said. So we will go straight to tonight's discussion. We are behind time. We're really sorry for that. It was due to some incontingencies. All right. So tonight we'll be looking at the principles of contraception and types of contraceptives. And well, as sensitive as this subject is, we decided to bring it up for public consideration. Immediately this subject was put forward and the flyer was out, we discovered that there were a lot of concerns raised by people. And I mean, the moment that flyer came out, I heard a lot of things. There were people who sent messages expressing concerns. Majority showed interest, not so much publicly, but in my DM, like I said, and others were were indecisive. And also, well, that's good. That's fine. I will tell you why we chose the topic. I'll tell you why we decided to bring this up, right? Irrespective of how sensitive the topic is, there is something that is going around the society that is raising concerns for health professionals. I wish to assure you that in JL Health Consult, we are resolute to minimize or minimize drastically the hazards that are caused by drugs, even the aftermath of the hazards in members of society, while we maximize the therapeutic outcome of this medication and also improve on the general health and well-being of the people, right? So we are set to interface with as many persons as possible so that in less than no time, we'll get in touch with a larger portion of the society or large number of people, that the effect of what we are doing will be felt so easily. Now, our subject of concern today, like said, is the principles of contraception. Why do you choose a method of contraception? What are the reasons to consider before you decide to go with a particular method of contraception, right? So you ask yourself, what is contraception or what are contraceptives? Yeah, contraception is the ways you choose for your child for birth control, let me put it that way, is just birth control strategies, birth control methods. And contraceptives are those medications that you take or are used in preventing pregnancy, okay, used in birth control. Now, there are two major things that make this topic very sensitive. There are two major things that make this topic very sensitive. The first of it are the concerns that people raise towards the topic or concerning the topic, and the second are the challenges that hovers around the topic. Now, when people hear contraceptives, contraception, especially when you are in a very cultural environment, like an environment that holds culture, holds tradition premium, these concerns are massive, right? These concerns are significant as compared to societies that doesn't have a kind of a kind of culture and tradition that is held that high. Now, what are the concerns that people have concerning contraception or contraceptive? The concerns that we should have. First is unplanned pregnancies. Unplanned pregnancies. Some people, when you hear contraceptive, what should bother you is, what if I don't take these medications? What if I don't go this way of contraception? What about the unplanned pregnancies? I won't say unwanted, I won't say unwanted, but unplanned. If the pregnancy comes and I'm not ready for it, is it better that way than the time I would have taken contraceptives? Okay, so should I prioritize being in an emotional disorder or being disturbed emotionally or going into something I've not planned for than to take contraceptives? Okay, and don't forget that if someone goes into this, like having unplanned pregnancies, there are several things that accrues. For instance, the abortion that follows. Uh, abortion is actually something that generates a lot of concerns in society, especially, like I said, in cultural societies. Yeah, highly traditional societies, especially in Nigeria, where people can be segregated, people can be traumatized. I mean, people can be made to feel not part of the society because of having unwanted, especially for the unmarried, for the singles. So is it better to go the contraceptive way or to have unplanned pregnancies? Another concern is the hazardous effect of these medications, which stem from either self-medication or poorly managed therapy. Okay, is a concern that is raised. What about the hazards? What about the side effects? What about the adverse effects, like real adverse effect that comes from this contraceptive? Okay, how do you manage them? How do you go about them? All right. So, looking at these two concerns, it increases the sensitivity of the topic we are talking about. Then let's look at the challenges. What makes it so challenging? Some of the challenges that surrounds this concept of birth control include, but not limited to, lack of awareness or lack of proper comprehension, or let me just put it simply, ignorance. Ignorance. This is more prominent in rural areas, in our villages, in our suburbs, in places where there are no proper education. Okay, so it's a major challenge. For instance, I heard of a story where someone told the husband that she was not going to take a contraceptive because the husband is not taking it. Now, how do you see that statement? How do you see that comment? A woman, the family have planned, we don't need a child yet. But she is saying that she's not going to take that contraceptive because the husband is not taking. That shows some level of lack of awareness, some level of ignorance. I'm sorry to say. Then another thing is belief systems, thought patterns. This belief system, I can categorize it into two: religious beliefs and scientific beliefs. Yeah, scientific, we can say it is when I say scientific, I don't mean it's been taught out or experimented. I mean a school of thought. Okay, I mean a school of thought. So the religious belief system, some cultures and traditions have been sounding this, prohibit some or any form of contraception. They prohibit it, right? They don't want to hear anything about contraception. Now, science, for instance, that's the second one, says some school of thought. I will have to qualify that some, not all, and not proven. Not proven. So some school of thought says the use of spermicides is against human, is against life. Why? Because they said a cell is a functional unit of life. Quite all right. And sperm cells is a functional unit of life that when it comes in contact with eggs or with the ovums, brings a full human being. So why do you kill a cell? Why do you kill sperm cells? That is a concern, is a big challenge, because people that are not informed and people that are not well educated and have a thought of their own rationally can fall to this. They can fall to this. All right. Now, if we have anybody that is using that as an excuse for not actually doing family planning or birth control, I will ask these questions. This question: what happens to you when you go to the hospital and the doctor recommends that you do what we call semen MCS? Semen MCS is like they take your semen, microbial culture and sensitivity test is being carried on it, and at the end of the day, the sperm cells will die. So what do you think of that? Like, how do you see that as compared to preventing a sperm cell from fertilizing the egg? In both cases, the sperm cells die. So why mounting pressure on people or on a society, telling them if you use spermicides, you've killed a cell and you've killed a life? Well, that's actually a school of thought. I'm not here to approve of it, and I'm not also here to condemn it. Then the third challenge we have is presupposed ethics. I call it presupposed ethics. Yeah. This Why it's presupposed is that it's not a standard way or standard in quote right way of doing things. It's not standard, but some people call it ethics. I give an example. Someone was in an interview, a health professional, and the interviewer asked a question. He said, if a lady below 18 years comes to your pharmacy asking for emergency contraceptives. Like when I mean emergency contraceptives, I mean people that are used to posting or two, you're used to any of the levonorgestrels and any brands at all, or any emergency contraception that you can come across or you can mention. So the person asked this candidate, will you dispense an emergency contraceptive pill to someone that is under 18? And the person really answered, said that if I will collect the patient or the customer or the client, I'll collect the person, like ask questions. What happened? Did you have unprotected sex? And if it is true that she really had, then she would dispense the medication. Then the interviewer said, "No, you are wrong. You are wrong. That if you dispense the medication, you are encouraging fornication." Well, I would have sided this interviewer in a way that maybe if he thought of the fact that this person is not yet an adult, is not accountable yet, okay, regarding the laws of Nigeria, you must be 18 years and above before you can be termed to be an adult. Sorry. So I would have really understood that. But this is another different thought that you're encouraging fornication because someone came for a contraceptive pill. This person is not ready for pregnancy, mind you. All right. So we are just trying to talk about the challenges that we have. So those are the challenges we have. Like, to summarize the challenges, we have the religious and cultural beliefs, we have science or school of thoughts that are against the use of contraceptives, and we have presupposed ethics that secludes people that should use contraceptive pills, people that shouldn't use. Now, all these and many more are the challenges bordering on the subject of using both, I mean, birth control pills. These are the challenges we have. Now, let's talk about the principles of contraceptives. What are the principles? What should affect your choice? Okay, what should affect your choice of contraception of contraceptives or a method of contraception? One, safety. The safety of the contraceptive pills or the contraception method should be paramount to you. I mean, it is the most prioritized principle because of what the side effects of the medication and the adverse effects of the medication. More so when it serves as an enabling risk factor, an enabling or a risk factor for dangerous diseases like cancers. Okay. Now, if you want to choose a particular method of contraceptive, we are going to talk about the method of contraceptives, quite all right. But you want to choose a particular method. I have said here that the first thing you must consider is the safety of that medication. And I know that today we are enjoying the dividends of science and technology. The AI is there, and I can't count the number of people that come to the pharmacy with their phones and they've already asked AI before they come and ask me as a pharmacist. Yeah, it's good. I'm not discouraging you, but you need to ask a health professional. AI cannot be as comprehensive and memorable, be able to use memory, past experiences, and even present experiences to click you, to know your history, and to know what best that you will take. It's just a guide, okay, a guide, and provides information most at times. But the most times rather. But the thing is, you must ask your health professional which method is safe for me. This health professional is going to will most likely ask your history, ask about your history, ask about what you want to achieve, and then tailor it down to the actual contraception method you would need. I believe that is clear, right? Then the second principle of contraceptives or choice of contraception is effectiveness. You wouldn't want to get a contraception method and go through all the rigors, and at the end of the day you still get pregnant. That will be a waste of time, a waste of money, a waste of resources, and will really, really be emotionally disturbing. Okay. So you need to check very well with your healthcare provider what method will be effective for you per time. Then the third principle is availability and accessibility. Okay, you wouldn't want to choose something that maybe if you are doing or a combined oral pills that you need to take every day, and perhaps you finished a month pack and you want to continue, you don't have access to that medication anymore. So choose a contraceptive or contraception method or contraceptives that are available. Four is affordability. I know this is through social stratas. I would not like to talk much about this. Many people have the means of getting their contraceptives. Many people doesn't have. But talk with your healthcare provider, and he or she is going to choose a very affordable um, method for you based on your your explanation, or you talking to him or her in a detailed manner that will reveal what you want. Okay. The sixth is ease of removal or discontinuation. There are some contraception methods that um need maybe implants or inserts. Okay. Implants, we have inserts, we have some cervical caps, we have things that you will need to insert or implant. Okay. So if you know that you'll be in an area where you lack the luxury or you lack the expertise of removing a particular device, let's say an intrauterine device, you wouldn't want to choose that method, right? So choose a method that will be very comfortable for you to remove or convenient for you to remove or discontinue if you choose to. Then the last the last principle of contraceptives is reversibility. Like you want to go back to fertility. Yeah. Okay. For instance, let's say a man that wants to just have some contraception method, but would like to give birth. I mean, to have children in the future. And that person goes to the doctor and says, "Doctor, I need to carry out vasectomy. Like I want my vas deferens to be cut out. Okay, so that sperm do not enter my semen and do not fertilize the eggs of my partner." You see that is not rational. That's not rational, because if your vas deferens is cut out, it it is almost impossible. I use the word almost impossible to fertilize an egg. Okay, because your sperm will not enter your semen. The semen that will, or the ejaculate that will come out will be void of sperm if you carry out a vasectomy. So you cannot reverse to fertility. That is, if I don't know if there are any technological approaches now to reverse that, but I know that you cannot. You cannot for now. Then this will lead us to methods of contraception. Methods of contraception. In this, we would identify the types of contraception as well. Yes, so I will categorize this. There are several ways of categorizing it. First is the reversible, and second is the non-reversible, okay, or the permanent. Another way of categorizing or methods of contraception is hormonal or non-hormonal. But I choose to go with uh, the reversible and permanent categorization, because it comes with a lot of ease and will make us understand a lot. Okay, so the reversible method, that's category A. First, we have the barrier method. Now, when I mean by reversible, I've explained it, but for detailed explanation, reversible means you can go back to fertility after using this method. you can go back to fertility after using these methods. And there are a lot of them, but I'll take them just one after the other. And this will also include their effectiveness. But I choose not to go with the effectiveness out because we have a speaker for that already. By Sunday, pharmacist Ceci will be talking about the effectiveness of contraceptives, and she will dig deep into this and reveal the details to you. I would just mention them while passing. Okay. So the first is barrier method, and number one there is the use of condoms. Use of condoms. We have both the male and the female condoms. The male condoms, you can also call it external condoms, and then the female condoms call it internal condoms. Then an advantage of this is that it prevents STIs, yeah, to some extent. Majorly, some people will tell you up to 90%, some people tell you up to 80%. We have several thoughts depending on the quality of the condom. So it's not 100% effective. The use of condoms is not 100% effective. We see that the use of male condoms have 13% failure rate, which means out of every 100 persons that uses male condom for the purpose of birth control, 13 of them might fail. 13 of them might fail using male condom. Then using female condom, out of every 100 persons that uses female condoms, 21 of them might fail. And you don't get I'm saying this so that you don't get worked up. You can choose your method very well. Okay, and all this information is available to the healthcare provider, your pharmacist, your medical doctor, to guide you properly. Okay, then the number two barrier under the barrier method of reversible method of contraception is diaphragm or cervical cap. This is like a diaphragm or a cap that is being inserted. Okay, and it has to cover the head. I mean, of the cervix. It has to cover so that sperms do not go through in into the uterus. Okay, and into the fallopian tube. Yeah, my time is fast spent, and we'll need to hurry up. So I'll be doing much of the mentioning. Number three of the barrier method is sponge. This sponge is like a sponge, like very soft. I mean, so it contains spermicide, and it is placed in the vagina where it fits over the cervix, and it works for 24 hours, right? And it must be left in there even till after 6 hours of the last intercourse, right? Then the fourth one is spermicides. Yeah, these spermicides, they could be in gel form, they could be in tablet form, they could be in, when I mean tablet, I don't mean oral tablet, I mean insert. Okay. Then we have other forms of spermicides that comes in like a pH regulator. It's not actually spermicides, but they adjust the pH of the vagina so that sperms do sperms find it so difficult to swim through um to fertilize the eggs. All right. So pharmacy, like I said, we do justice to these by stating how effective they are, and you can make your choice from there. And note that no information we are giving here is enough for you to make a choice on your own. You can get the right, I mean, the one that suits you, and get to your healthcare provider for proper guidance, right? So the second method of contraception of reversible contraception is fertility awareness based methods. Fertility awareness based methods. This is achieved through a proper understanding of your monthly fertility pattern. Okay, there was a seminar we did the other time, and we lectured people on especially ladies, especially majority of ladies, on how to use their cycle, their monthly cycle, um, in calculating the fertility patterns, or in determining their fertility patterns. Okay, yeah. So you can, if you have access to that seminar, you can go back to it, or you can drop a message here and I'll give you the link to the seminar. Yeah, so your fertility pattern is the number of days in the month when you are fertile, including the days when you are not fertile, including the days you are unlikely but it is possible to get pregnant. Right? Do you understand that? So those three um patterns put together formulate your fertility pattern. So if you don't want to get pregnant, you need to avoid having intercourse on the days you are fertile, including the days you are unlikely but have the possibility. Okay. But if you know that you are not very sure of your fertile days or the days you are unlikely, you can use the barrier method. Okay, you can use the barrier method or use any other forms of contraception. Now, the third the third method here under the reversible method is lactational amenorrhea methods. Don't worry, I will explain. Lactational means you are breastfeeding. Then amenorrhea means you are not menstruating. Okay, there is no menstruation at all. So breastfeeding can be used as a form of birth control. I know that this is what our mothers, some of us that came from the rural areas, or we are in touch with rural practices, we know that this is a natural method of birth control. And there are three principles you must observe, or you must keep to, for this method to work for you. The first is that, like I said, number one, not having any menstrual periods after delivery. After you've given birth, you have not returned to your cycle yet. Okay, and I know that prolactin plays a major role in that, but you ensure that you have not had any sign of menses or menstrual periods coming. So secondly, you are fully or near fully breastfeeding. You are fully or near fully breastfeeding. Yeah, so for people that are doing, I mean, let me use the common word now, baby friendly, you, from the first day or from the first week you give birth, you are using maybe prenan, you're using all these formulas for your baby, and you are not breastfeeding. This method is not for you. This method is not for you. You have to be fully or nearly fully breastfeeding, so that that negative feedback mechanism can lead to the production of prolactin, like more production of prolactin, which will not encourage fertility to take place. Then the third principle you must keep to is that it must be less than 6 months after delivery. Less than 6 months. So you are not having your menstruation, no period is coming. Secondly, you are fully or near fully breastfeeding. Thirdly, it has to be less than 6 months of delivery. If these three things are intact, you are good to go. You are good to go. Your contraception is assured. Okay. But if any one of the condition is distorted, you should consider using other methods of contraception. You should consider using other methods. Now, the fourth, the fourth reversible method here is emergency contraception. Emergency contraception. But before I go to that, because that is a whole lot. Let's talk about the intrauterine contraception. These are devices. Okay, we have intrauterine devices. You can fit them in to the vagina, and then you are good to go. They have progestins. Remember, I am really aware that I'm talking to the public, and I'll need to keep some things down so we can flow better, right? So this has some are T-shape, like the intrauterine devices are T-shape. You can insert them into the vagina, and as long as that is there, it releases doses of medication every day, every day, and it can stay there for about 3 to 8 years, 3 to 8 years, and you are good. It has a very minimal failure rate, 0.1 to 0.4%, which means out of every 100 persons that have this inserted, the person can, like, out of the 100 person, only 1 person, or out of a thousand, sorry, out of a thousand person, only 1 person can have a failure um registered to this, or 4 persons, like 1 to 4% out of 1,000. That is a very good rate, and I believe that on Sunday you have more of this. Then another one is the hormonal method. Hormonal method. Hormonal method is reversible. Okay, so if you want to go back to fertility, you wouldn't have any issue with that, right? And this hormonal method includes the implants, like I've said, intrauterine, no, sorry, implants, which are single thin rod equipment that can be inserted into maybe your upper arm, can into your muscles. All right. So this is done by a medical doctor. You don't you don't try this by yourself. Okay, don't try this by yourself. So implants is there. It's inserted under your skin, like I said, under your skin, not in the muscle. Sorry, pardon for that. Then the second is injectables, injections, or you call them shots. Okay, these shots are given maybe probably every 3 months. And the third here under hormonal method is combined oral contraceptives, or you call it the pill. It has both estrogen and progesterone. Then if you are older than 35 years, or you smoke, or you have a history of blood clot or breast cancer, you will need a special attention. Your doctor might advise you never to take this because it has estrogen and may lead to, may predispose you to more dangerous effects. Okay. Then the third one is progestin on the pill, or you call it mini pill. All right. And this is a good option for women who can't take estrogen. Right. Then we also have the patch, like a transdermal patch. You just um adapt it to your skin, or append it to your skin, and it will be releasing certain amounts of the medication per time, right? Then we have the hormonal vaginal contraceptive ring. Hormonal vaginal contraceptive ring is, it releases both estrogen and the progestin as well. You wear a ring inside your vagina. You take it out for the week you have your period, so that you can have what we call a breakthrough bleeding. Okay. Yeah. So I think I've done justice to that. Then let's go back to the emergency contraceptive now, or emergency contraception, before we move to the last aspect of these. Yeah. So the hormonal, the emergency contraception rather, like the name implies, it is an emergency uh, procedure, emergency method. It's not usual. It's not your regular method. So it's not something you take every time. It's not something you you bounce on or you go with every time. It is when needed, and that when needed is not every time. Emergency. Like for instance, you were having an intercourse with a barrier contraceptive like your condoms, and the condom broke. You can decide to use an emergency contraceptive, right? Then this method is taken either before or during sex and has an expiry. The expiry could be in 5 days. There are some contraceptives, emergency contraceptives that takes 5 days. Like if you've had intercourse within the first 5 days, it can work. The ones we know too well is within 72 hours. That's 3 days. It can work. And there are also some like copper IUD. Copper IUD takes 5 days. If you've had intercourse within 5 days, it can work. But I've left the effectiveness so much, and I didn't talk much of the physical scenarios that we have because we have someone to talk about them. But let me chip this in. Sometimes you'll be in the pharmacy and someone comes to you and said, I had intercourse 4 days ago, more than 72 hours ago. Can I still take contraceptive pills? There are some that will work, there are some that will not work. And that is the reason why you need information. You don't just go to the pharmacy and just get the medication. You don't give any explanation, you don't express any concern, and you go home with that medication. You're going to have failure. You're going to register failure. And we all know that it could be traumatizing when it comes and can lead to some other things that you never planned for. Okay. Now let's go to the permanent methods of birth control. The permanent method. If you are not ready for this, please don't go for them. If you are sure that you would want to still be fertile, if you want to still be fertile, please don't go for these methods. Okay. Now, the on my list, the first on my list here is tubal surgery or tying tubes. We call it tubal surgery or tying tubes, right? So the fallopian tube here are tied. The both sides of the fallopian tubes are tied or closed or cut so that sperm and eggs cannot meet for fertilization to take place. Okay. Yeah, so that's what happens in tubal surgery or tying tubes. Okay. This is done in the hospital quite all right. And patients can go home same day. That same day, the patients can go home and can resume normal duties after some few days. And it has a failure rate of 0.5%. Right. So out of every 1,000, you can register 5 failures, which is still effective. Then the last on my list is vasectomy. I think I made an analogy with this before. This procedure keeps sperm from going into the penis so that what is being ejaculated has no sperm to fertilize the egg. Okay, so the ejaculate is void of sperm. I know somebody of sperm cells. Somebody asked this question before, said if someone does vasectomy, can the person still ejaculate? Yeah, very true. The person can ejaculate, but will the ejaculate or the semen, the substance that is being ejaculated, will be void of sperm and cannot fertilize any egg. Yeah, but there are precautions to this. Okay, there are precautions to this. You have to go and verify if your sperm count has been dropped to zero. Some people does vasectomy and they go on having intercourse. By the time before you know what's happening, this person has fertilized somebody, fertilized the eggs, and maybe the spouse is pregnant. Don't if you have to go into intercourse, please use other methods of childbirth control. Use other methods for the first 12 weeks. After then, when you verified that your sperm count has been dropped to zero, that's when you will be sure that you will not be able to fertilize or cause pregnancy to take place. Now, we've talked about a lot this night, and my time is almost up. My time is up. I would like to entertain some questions before we call it a night, or do a summary for those that are joining us now, and we'll get ready for tomorrow. So let me check the chats if there are questions. Okay, thank you, Joy. I can see you there. Thank you, Smart. I can see you there. Yeah, Jatal, thank you. Thank you very much. So if you have a question, please drop it. We have a pool of questions, but I want those that are online to please drop their questions. Okay, okay. All right. Thank you very much. Thank you very much. Yeah, I did mention someone below 18 years coming into the pharmacy to get an emergency contraceptive. Yes. If I were to be the one, if I were to be the one managing that issue or answering that question, I will take it from both ends. Yes, we have very smart ladies nowadays. I mean, smart young girls. Um, I'm not supporting sex after marriage. Don't get me wrong. I'm not supporting sex after marriage. But if this lady, let's say this girl, young girl, below 18 years, come to the pharmacy asking of an emergency contraceptive pill, first of all, I will ask relevant questions. What happened? And be sure that this person knows what actually she's coming for. Okay. Then secondly, I will have to verify the safety of this person in question. I'll let her know the dangers, okay, of premarital sex. It's not only pregnancy that is a danger of premarital sex. Okay, we have STIs, we have several things, dangerous diseases that can be transmitted sexually. So it's not just all about the pregnancy. Education is key in this. You educate this young person and let her know. Okay. But in my own case, I'm not sure I would let her go away just like that. She can go elsewhere and still get that contraceptive pill. So what will happen is I will inquire if I can get the consent of the parent. Okay. Now there are more tailored way of handling this. There is a way you talk to somebody. Those of us that are clinicians, those of us that have worked so much in the community space, there's a way you talk to somebody, because by the time I said I will get the consent of the patient, some people might shout, the lady will run. No, you can get somebody, talk to the person, and highlight the dangers of what is happening and get into this person, and you have a way around it. Well, so that is my take on that. That is my take on that. If the parents give the permission, if the parents give their consent, then we can go ahead and dispense the medication. All right, but we won't. I will not personally. I will not send that lady away. I will ensure that there is a solution. I will ensure that we prefer a solution to that. Yeah. So, do you have any other concern before we go to our pool of questions? Okay. So the questions that people have expressed, I mean, I've asked before now, said, are those that have religious beliefs regarding contraceptives entirely wrong? Religious beliefs, traditional beliefs, are they entirely wrong? Well, well, I would say religion is very important. Okay, traditions are what people hold dear to them, and they would rather fight anything that wants to negate their tradition, negate their religion, um, instead of siding it. Okay, instead of siding those factors that negates them. Um, the scope of this lecture is not to bend anybody to accept taking contraceptive pills or not. It is actually for those that are already taking, like the name implies, it is drug safety webinar, right? It is drug safety webinar. So we are trying to look for safe ways, I mean, ways to bring these people into safety, those that are already taking and those that wish to take. How best that they can take it and avoid the side effects, avoid hazardous effects, and maximize the effects. So for those that have decided they don't want to take, you no, you are fine. You are very okay. You are fine. You don't need to push it hard, right? But I also believe that you'll be able to use the natural methods that are acceptable by your tradition and religion to to put yourself into control when you don't need a child yet, because we know what could come from, I mean, unplanned pregnancy. Okay, now someone is asking this question, said, can contraceptive drugs cause barrenness? Can contraceptive drugs cause barrenness? All right, i I decided not to go into any of these because tomorrow we will be talking about the dangers of misusing and abusing contraceptives. My own work today was just to do an overview of what contraception and the principles behind contraception and the types of contraceptives. Okay. But for the reason of this question, Prudence, I'll answer you this way. Contraceptives are safe. Okay. when they are used within the confines that are detailed by professionals, they are safe, right? But when they are being misused or when they are being abused, they can cause cascades of things that you can never imagine. Okay, they have hazardous effects. When I mean hazardous, they have hazardous effects, like very dangerous effects, or you call them adverse effects, right? So if you use contraceptives the way you should use them, I don't think, if the person doesn't have an adverse effect to it, I don't think there will be barrenness. But if it is used outside the confines of the normal use, I think it can cause so many other things, including barrenness. Now, there's a mechanism for that to happen. Is an event, it's a cascade of events. And we don't want to come here to discuss pharmacology because it is a public space and not just professionals here. So we want everybody to be in tandem. So my summary to this, my the summary to this is that contraceptives should be used within the confines that is been defined by professionals. Okay, don't misuse them, don't abuse them, so you don't have the adverse effects. I hope that is fine, Prudence. Yeah, thank you so much. Thank you so much. All right. So from the pool of questions gathered before the lecture, we also have this: can contraceptive cause cancer? Can they cause cancer? Okay. Well, in answering this question, I would say contraceptives are just, they increase the risk of cancers, right? We've learned about estrogen. Estrogen serves as like a contributing factor, feeds cancer cells. So if someone is predisposed to cancer, someone is at risk of having cancer or contracting cancer, or the person have had cancer before, you are not a candidate for any estrogen containing contraceptive. Okay, you need to work with a doctor, you need to work with a healthcare professional, a pharmacist, and receive right guidance on the contraceptive that you would use and will not increase the risk of cancer, right? I think we've done justice to the. Okay, so we have another question here. Which contraceptive is the best? All right, that's a very intelligent question. Quite all right. Which contraceptive is the best? Well, like we have illustrated, or I have kind of um, sketch the methods of contraception. I will say, I will say there is non-contraceptive method or contraception method that is the best in quotes. It is just the one that fits your condition, the one that fits your situation at that moment. Okay? Because like I said, most contraceptives are failure rates. And what you could think that is the best could have failure rates. Okay, but there are some contraceptives that you will say that this would have been better for me, but you are not a candidate for that. That is not the best for you. So, simply put, it is the best method for the best candidate. I don't know if you get that. The best method or the ideal method for the best candidate that is the best for you. So there is nothing like this is the method that is the best. Okay. All right. Yeah. When we come to contraceptives, like I said, there's no best bet. Now, If you don't want to take contraceptives at all, you can just abstain, right? You can just abstain. Yeah, abstinence. I don't know if it's a type of contraception. Yeah, it is. Okay, good. So you can abstain. Do you understand me now? All right, good. I think I should have to buttress on that. I have to buttress on that. So for those that have very rigorous tradition, very rigorous cultural belief, or even the scientific school of thoughts that negates the use of spermicides and others, I think abstinence is the best, right? Abstinence is the best. But for married couples, you will know how to go about that. All right, discuss with your doctor and get the right approach for yourself. Okay, I think we will call it a close here for tonight. Yeah, we'll call it a close. Tomorrow we'll be having pharmacist Chidi Okeke, and he's going to take us on the adverse effects. Okay, he's going to take us on the bane of misusing contraceptives and abusing contraceptives. So if you want to know more about the dangers that one stands to face if contraceptives are being misused or abused, or even when it is used in the normal context but used for a longer period of time, you have tomorrow to deal with. Okay, thank you very much for tonight. Have a blissful time, and mind you, health is very important. Stay safe.